we'd also like to thank each and every one of you for the difference that you have made in Nicaragua through your prayers, through your encouragement, and through your support. We know that you guys have done so much for us, and we want this chance to thank you. We're so glad Cheryl pressured those children into giving their 10 cents for the deworming program. That's been a huge program that's helped so many children. The mission teams that you guys have sent, we're so grateful because of the accompaniment and the support and the projects that you bring, and just the accompaniment that you do when you come and serve alongside the people of Nicaragua. And also to thank you for the Faith Builders class, who every month we see a support from them. So we thank you guys for all that you do for our work in Nicaragua. And because of the work of all the support in churches and everywhere, today we're able to serve over 13,000 people who otherwise would have had no other access to health care in remote places in Nicaragua. And so I have a picture for you here from all our health promoters. They wanted me to be sure that wherever I went, I took this picture with me so that they themselves could thank you too for your support of their communities. We feel so blessed to be part of what many churches have done and individuals for Amos and our ministry, and being witness to this has definitely strengthened our faith and our call to continue to serve as medical missionaries in Nicaragua. If you know anything about me, growing up, I was probably the unlikeliest candidate to be a medical missionary. My parents are immigrants from Taiwan, and they actually, that little pressure that Cheryl was doing, Pastor Cheryl was doing with the kids, they sort of did that with us for becoming doctors. And so my parents actually, I come from a family of 64 physicians, and and so growing up, I actually didn't know there was any other profession than being a doctor. And my parents actually made some big sacrifices because they moved from Taiwan, because at the time it was very poor, to the United States to give us a better life. But at the same time also pressured us a little bit to become physicians so that we could have a better life in the United States also. So it's understandable that growing up, because of the poverty in Taiwan, that they wanted us to have more opportunities in the United States. And I know my parents sacrificed a lot and worked hard so that we could go to college and go to medical school and I could become a family medicine doctor. But then that's why I think they often ask me, like, what happened? Like, why do you work in a place where people make less than $2 a day and where it's actually worse than Taiwan? But, I actually have an answer for my parents, and that it was actually their example of Christian service and commitment, because my dad is a doctor too, and growing up with him, we'd go with him on home visits. Our house was always open to anybody who had a medical problem, came in. I just thought it was normal that people come at 9 at night, and just before I left, my dad was seeing someone at 9 at night, so it's just like a way of life. And so it was his example of service and commitment that actually set the ground for me to be able to serve and to go on faith to see what we can do in Nicaragua. But never actually in my wildest dreams did I think I would actually be in Nicaragua, because I thought maybe I'd just go visit and help out. But it was my husband his parents are Joan and Gustavo Parajon. Does anybody know them? Yeah, they are missionaries also with American Baptist churches, and they gave him an example also of love and service. And so he came to the United States to get all his medical and public health training, but he was determined to go back and serve his country as well as a missionary. And so after getting all our medical education and paying off all our loans, I was actually really excited because we had a little minivan after we paid off all our loans. We could fit all our kids into the minivan. And that's when my husband proposed the idea of becoming a medical missionary in Nicaragua. And at first, living in suburban United States, it was a little hard for me to get the idea to do it. But once we got there and once we were able to see the people and how we can serve together, it is not a sacrifice to be a medical missionary. It's a privilege to be able to serve alongside all of our churches in the United States, to serve along many people, to be able to serve some of the poorest people in the world in Nicaragua. Our ministry was actually inspired by my father-in-law, Gustavo Parajon. He was truly a man of faith and love, and he was a beloved physician, a pastor, a missionary, and a leader. And he was a humble and devoted servant of God. And throughout his lifetime, he won many awards like the Baptist World Alliance Human Rights Award, but that never mattered to him. What mattered to him was his ministry to the poorest of the poor in Nicaragua. He worked and mentored countless people to lives of service, and he taught us two important things which we still carry with us today. First was the message that he lived out and preached, and that was Christian faith and social responsibility and leading by being a servant. And the second one was really important to me because I'm a doctor, that in Nicaragua, a doctor should not be a doctor, but to be a teacher, to teach other people to bring health to the most needy, to the most forgotten, and the most vulnerable. So those of you who are doctors or carpenters or anything like that, when you have a hammer, everything looks like a nail, right? And so I was a doctor and I was trained in the United States, so I was so excited that I was going to see tons of patients and cure tons of people. But my father-in-law said, no, actually learn from my mistakes, learn from what we have done here in Nicaragua. And so he shared with us the story of how he got involved in health work, that in the early days he would visit a community with a medical mission team with all his medical doctor tools and treat a child for diarrhea, but then come back a month later to find that that child had died of that completely preventable and treatable disease. And so it was at that time that he started to get the idea that, wait a second, I don't live in these remote rural communities, and there's so many remote rural communities, I can never get to all of them. Why don't we train people called health promoters who live in their own communities, who can treat the most common causes of illness and death? So for instance, diarrhea, you can treat that with a simple solution of water, sugar, and salt mixed together, and as long as you know what to do. And so that's what he started to do. He started to train health promoters throughout Nicaragua, and that no longer did children die of preventable diseases. And when you go to Nicaragua, those of you who've been there and been in the rural areas, it all makes sense because the houses are so distant from each other, and health care needs to be brought to the people. Children dying of simple things like pneumonia and diarrhea, which you hardly ever see here in the United States. And medicine is a luxury that people they can't even get to, they have no access to. There's no Rite Aid or Walgreens right around the corner. You have to go 3 hours carrying a baby to get to the nearest health care. And so what our ministry does in Nicaragua is make health care accessible to the people who need it the most. At Amos, we emphasize a bottom-up community approach to healthcare so that the people themselves can treat the most common illness and to promote healthcare rather than a traditional top-down hospital-based approach. We believe that in every community there are capable leaders, regardless of their level of education, who have the skills and the passion and commitment to make a difference to improve the health of their communities. Are there people in your congregation who like to volunteer for everything? I imagine there are many in your community, and those are the people we look for in every community to become a health promoter. In Luke 4, Jesus begins his ministry with a call to heal, to release the prisoners, and to bring justice to the oppressed. And he is doing whole things for the whole person, and he calls us to do the same. The average poor child in Nicaragua is 3 times more likely to die than a child who is not poor, and is 6 times more likely to die than a child in the United States. And every day, there are 20,000 children who will die today of a completely preventable and treatable illness all around the world. This is something that in the news that we don't see every day, but it's happening every day, and is an injustice that repeated throughout the world. It is the poorest people who suffer the most and the worst consequences, whether it's death by disease, by accidents, or by war. And what we found in Nicaragua, and the beauty of it is that we can make a difference when we come together, because the new frontier is not new technologies. The new frontier is what we already know and how can we bring it to the people who need it the most. And that is where your church is helping to make a difference in Nicaragua. Through Amos, We have worked to train and mentor the Nicaraguan people themselves, Nicaraguan physicians, Nicaraguan nurses, and support staff who work in remote communities to provide health care in places where there are no doctors or nurses. We train the health promoters themselves to treat and prevent the most common illnesses and conditions that can kill women and children, and to manage a simple clinic that provides medications and that they themselves can work together so that they can improve the overall health of their communities. And our health promoters address not only physical health, but emotional and spiritual health. We train them to have relationships with the people in their communities based on their desire to serve and doing what Jesus would do. And we teach them that a prayer and a hug and a listening ear is often worth more than all the medicines in the world. And the results that we have found are amazing. In the communities, when we first started in 2006, it was a dream of what we were going to do with Amos. In 2007 and 2008, we trained the health promoters. And in 2009, we got the first data in from the communities that in their communities, the babies were dying at a higher rate than the rest of Nicaragua because they were poorer and they were in rural, remote areas. In 2010, after the promoters and the health committees worked together, the rate of death was less than that of all of Nicaragua. And then last year, no babies died in their communities. Praise the Lord, because of the work they did together. So we feel that if churches come together, if people come together, if we all can serve together, we can make a difference all over the world, wherever we are. And the last story I'd like to share with you is actually the story of Sabalete, where I know Dr. McElroy has gone with me on horseback, but this is quite far. And this story is the story of Adriana Lopez, shown here with her family. And her house is just about as big as this little front podium place where the children were standing. And her husband, David, is a poor sharecropper who makes less than $2 a day. They have 7 children, and one day Adriana did not get up from bed to make his rice and beans, which is what most women do. From dawn to dusk, they're just cleaning and cooking. And he saw that she was not getting up. She was bleeding with no signs of stopping after she had a miscarriage. So her husband ran to Pedro Pablo's clinic, which you see there, and it's a small little rural clinic. And he ran to Pedro Pablo and told her what was happening. And Pedro Pablo knew the danger that Adriana was in. So with the cell phone that Amos gives to all our health promoters as part of their medical work, he was able to call the government clinic that is our referral clinic for our smaller clinics. But he had to climb up a high, high hill because there's no signal there. He has to find a mountaintop where he has to go like this until he can find a signal to call the Ministry of Health. And there's only one problem. The government said, yes, we can come, but you have to get Adriana to the side of the road, because that was a mile between her house and the side of the road. And so this is what it looks like. Pedro Pablo and his health committee gathered 50 men and women to carry Adriana out of her house through the little jungle pathways onto the side of the road. And that's amazing, because it is hard to carry a woman out of her community. And they did that. And when they got there, the doctor of the ambulance could not believe his eyes of what he saw. He saw Adriana and 50 poor men and women surrounding her, and each of them giving her $1, because in the government hospitals, they often don't have money for food, and nor do they have money to get her back to the community. So all these 50 men and women offered all they had to her so that she could get back when she got better from the hospital. And the doctors asked this community, all the health committee members, so you see some of them over there, how is it possible? What type of community is this? They had never seen this. And you know what? The health committee replied back, we are strong because we are more than organized. We are united. And Pedro Pablo and his health committee says, the heart of this community is in the church, and we care for one another. In this next picture, you see Adriana. Adriana is alive today. And in small rural communities, mothers are the lifeline. When a mother dies, you are still considered an orphan, even if your father is still alive. So when you save the life of a mother like Adriana, you're saving the life of an entire family. And because of the work of everyone together, Adriana is alive today. To save lives in remote rural areas, we need people like Pedro Pablo and his health committee who say no more. No more to preventable mother deaths, and no more to preventable child deaths. It takes coordination with the government who have validated our health promoters as legitimate providers and first responders in their communities, and provide the referral facilities for cases that our primary health clinics cannot handle. And it takes people like you and your churches who believe in your missionaries all around the world, who believe that in mission we can accomplish what we cannot accomplish alone, to follow in the Bible Jesus' simple commandment to reach out to the least of these. That in verse 40 it will come true. The king will reply, "Truly I tell you, whatever you did for one of the least of these brothers and sisters of mine, you did for me."